Hi there, my name's Damien. I'm a paediatric emergency medicine consultant from Leicester, and I've been chief investigator of the BronchStart study since its inception. Loads of other people have been involved in this, and I'll name some of them at the end. But for those of you who have been on the journey with us, it's been a really long one. And we've been running BronchStart for the last couple of years. But the key thing to say is that we're going to have a slight alteration for 2024, 2025. And that alteration is the possibility of bronchiolitis really being altered by the presence of a new vaccine, which is being rolled out in the United Kingdom and Ireland. So this year is BronchSTOP, even though actually the study still remains officially BronchStart and the documentation still has BronchStart on it. And why is it BronchSTOP? Well, if you remember back in 2020, when COVID started, and this now feels like a lifetime ago, as soon as we went into a pronounced lockdown, the normal curves of RSV epidemiology just completely changed. And then we opened up out of lockdown, and then we were just hit by this huge wave, initially in Australia. But because we were able to know what had happened in Australia, a group of us quickly got together and wrote a protocol for what was essentially a prospective observational study of the impact of opening up after COVID on bronchiolitis epidemiology. And you'll see that given the fact that we only really started getting together in early 2021, we were pretty productive. And we've always been really grateful for the teams who have been part of BronchStart and made it possible for their responsiveness as well. And again, thank you for your hard work. We recruited over 17,000 individual patients. We demonstrated in a unique way. We were able to do this with some real-time visual graphics. That actually bronchiolitis itself didn't massively change. Yes, there were lots of it, but the proportions of those in terms of their ages, in terms of their comorbidities and their final destinations wasn't hugely different from a typical RSV year. But we attracted attention. We have some of the most up-to-date UK data. And when the RSV vaccine was considered by the JCVI, BronchStart was one of the two main studies cited as one of the decisions made to roll out this particular program of activity. And we live in exciting times. So from the winter of 2024, mothers in England, Scotland and Northern Ireland will be given a RSV vaccine while they're pregnant, with a view to reducing the impact of RSV-mediated bronchiolitis during that winter. So what have we done as part of BronchStop? Well, we've done some consultation already with PPI groups, thanks to colleagues in Scotland and Northern Ireland. And what we found is that the groups were quite happy with our current process, which is fairly light touch in terms of parental awareness of what's going on, mainly because all the data we're collecting is routine. But they would like to know that if we're going to access their records to get whether they have had the vaccination or not. And we know from some other previous work that actually we do need to know whether the mum has had the antenatal vaccine. If we just ask mother, they may get confused with other vaccines, they may not know, etc. And so we will be able to test actually in this study how maternal reflection accords with actual vaccine delivery, but we do need to get consent for that particular data to be obtained. And what we're doing is just asking the mums who are part of the BronchStart process that they give us their name and date of birth. We can go into record systems, get their NHS number, and then therefore go on and get their vaccination status. So for this year, what we want to do is estimate vaccine effectiveness. And so to do that, we need to know who's been vaccinated, but we will continue to do all the things that we've done in previous years, describe levels of care, respiratory support, and potentially through some qualitative work, which we have started doing, is maybe describe some predictors of maternal vaccine uptake. And so there will be a small protocol amendment which will allow us to touch base with mothers in a retrospective fashion, but to get their consent to do so we can do some formal qualitative work. Now, the process will remain as similar to previous years. Patient presents. We are looking for admitted patients. This is admitted patients like last year, not like the first year where we were getting all comers to the ED. This is for admitted patients. You will scan a QR code. It will give you access to a REDCap form, and you'll answer the first 3 basic questions. Is the child aged under 2 years or not? And do they have a first clinical diagnosis of bronchiolitis, an acute lower respiratory tract infection, or importantly, the first episode of wheeze? So if they're a recurrent wheezer, they cannot be part of this study. And then the parents know that they've been part of the study? They often don't know that we don't know that. But actually this year, there may be some parents who remember being asked questions about whether they've had the maternal vaccine or not. And so they may be able to say whether they've been recruited before. And then the next different part is that once you've confirmed which site you're on, we need to know when the child was born. Now, in England and Wales, that's going to be after the 1st of September 24, but Scotland have already got going with their vaccination programme, so that's the 12th of August of 2024. And that enables REDCap to work out the types of questions needed to be asked, because if you were in utero and you were able to receive the vaccine, we will ask a couple more questions of mum just about their experience of that vaccination program. If you've not been part of being able to be vaccinated, then it will be the normal BronchStart questions. What's really important, though, is that please do collect as many cases as possible. We don't want any preferential treatment. And what we really want to know is, because we're doing a case negative design for this, is that we've got as many patients as possible who do have bronchiolitis type symptoms, who are RSV positive and negative, and have been vaccinated or not vaccinated. So we need to keep that net wide, and we need to keep recruiting patients. And so either you're recruiting to the BronchSTOP and BronchStart. There are some groups that might just not want to do the consent process at all, and you can highlight that on the REDCap form. So this is where we are. It's some pretty simple changes. Thank you to everyone who's been part of this process so far, but notably you, the Peruki clinicians and other sites who have been involved as part of this study. So as a reminder, essentially it's the same process. It's for admitted patients, but we do want for those families who have been vaccinated, we need to be able to get consent from those mothers to be able to access their record, work out have they been vaccinated or not. We are going to submit an amendment that allows us to do that over the phone. So if you've missed them in hospital, you can contact them. There will be the 7-day follow-up as there was last year. And we probably will be running a direct study investigator meeting at some point in the next couple of weeks or months, and we'll let you know about that. But thank you again for your hard work, and happy hunting for this year's bronchiolytics.